This presentation is about MRCS Part B exam. What is assessed in this exam, how is this exam structured, and what to expect on exam day. There are live lectures every week for preparation of this exam, and you can attend these live lectures by joining this Telegram group. And there is no registration required to attend these live lectures. You can also write email on this address to get more information. Today we'll discuss about MRCS Part B exam. In contrast to MRCS Part A that is written exam, MRCS Part B is exam in which you have to verbalize your answers and also you have to perform different clinical and technical skills. These skills include history taking, physical examination and performing some procedural skills. Today we'll discuss about how this exam is assessed, what is assessed in this exam, and what is number of station in different subjects, and how are station organized, and about OSCE circuit. So before we proceed further, we need to understand these two terms. So this exam is assessed, or this exam assesses two broad content areas, and these broad content areas are assessed with four domains. So for now we just concentrate on what is broad content areas. The MRCS stations are divided into two main groups or two broad content areas. One is applied clinical knowledge that has 8 stations, and applied clinical skills that has 9 stations. So this is applied clinical knowledge. The question will not be what is course of median nerve. Instead, question will be a person has injury to his wrist and one nerve, which nerve is damaged, can be damaged, and how you will assess it clinically. So there are applied clinical knowledge and clinical skill stations. Now we discuss more about broad content areas. Applied clinical knowledge has 8 stations. Of these, 5 stations are that assess anatomy and surgical pathology. Of these, 3 stations are assess anatomy and 2 stations are surgical pathology stations. And then there are 3 stations, that is applied surgical sciences and critical care are critical care stations. So we have total 8 stations that assess applied clinical knowledge. And we have 9 stations that assess applied clinical skills. Of these 9 stations, there are 4 communication skill stations, and of these 4, 2 stations are history taking stations. So in this station you take history from patients who are actually not real patients but they are actors, but you take history from them. And 2 stations are of information giving or receiving station, but it's usually information giving stations. In one station you give information to a patient or his relative, and in second station you give information or you discuss a case with your consultant or another senior colleague. So 4 communication skill stations and 5 clinical and procedural skill stations. Out of these 5 clinical and procedural skill stations, 3 stations are clinical examination stations in which you do physical examination like examination of shoulder, examination of hand, examination of abdomen, and there are 2 procedural skill stations. So we can see that each broad content area has several stations. To pass this exam, you have to pass in both these components. So applied clinical knowledge has 160 marks, so there is a pass mark and you have to get marks above this pass mark. And similarly, applied clinical skill has 180 marks and you have to get pass marks above the pass mark. Even if your marks you do not pass in individual station, or but if your overall combined marks are above the pass marks in applied clinical knowledge, you will pass this component, and if you pass both components, you pass the exam. Now we'll discuss what are 4 domains. So 4 domains are in stations are assessed based on these domains. They assess these 4 domains in stations. So what are those domains? Domains 1 is clinical knowledge and its application, and clinical and technical skills. Clinical knowledge and its application, like they ask question in anatomy, pathology, and assess the clinical knowledge. But this knowledge is also assessed in other areas, like even when you are discussing a case with colleague, there are some marks for knowledge, but the applied clinical knowledge stations have more marks related to clinical knowledge. And then the second domain is clinical and technical skills, like your physical examination and doing different procedure skills like hand knot tying or passing a chest tube. And communication skills, although there are 4 communication stations, but communication is also assessed in some other stations as well. So, and last one is professionalism. We'll discuss it later on. So all 4 domains are not assessed in all stations. Like applied surgical pathology and anatomy stations, only this domain is assessed, clinical knowledge and its application. But in procedural skill, clinical and technical skills are assessed, as is professionalism. And in communication skill, although communication skills are assessed predominantly, but other skills are also assessed, like knowledge and professionalism. So these are the 4 domains. When you get exam results, you also get results in these domains, but you do not need to, there's no pass mark in these domains. This is just for your information, how much marks you got in knowledge and how much marks you got in communication skill. So now we have discussed this, how exam is assessed, how exam is structured. Now we and how many stations are of different subjects and components. So now we discuss more about the stations. So there are 17 total examined stations, as we have discussed, 8 clinical knowledge stations and 9 clinical skill stations, and there are 2 rest stations. In this station you just wait for 9 minutes, and they are not assessed, there is nothing assessed in these stations. And there are 2 preparation stations, and what are these preparation stations we'll discuss later on. So this is now brief summary what we have already discussed up to now. Now we mentioned about professionalism. So professionalism is assess these components, that decision making, problem solving, situational awareness and judgment, organization and planning, Like when you're doing procedural skill, you need to get your instruments and sutures before starting procedure. If halfway you remember you didn't get your suture or like this, so that's the organization and planning. And also organization and planning when you are doing examination and history, how you modify your approach. Also consists of patient safety. You keep patient priority, patient's interest your top priority, and you keep commitment to high professional standards. So now we have discussed about stations. Now we just see how one station is structured. So each station lasts 9 minutes. Suppose this is a station. Before the start of station, you are given 1 minute to read the instruction which are written outside of station. Then you go to station, you will find one or two examiners there, and suppose it's an anatomy station, you answer the question, you see the diagrams, figures, radiology tests, you answer the question, and each station lasts 9 minutes. Most of station you do your task in 9 minutes. However, you hear two bells. One bell is after 6 minutes, because in some stations like history taking station and examination stations, you stop at 6 minutes. You stop taking history, you stop doing physical examination. So after 6 minutes you hear first bell, and then after you have finished with history taking and physical examination, then examiner asks you question, what is your can you describe finding, what is your possible diagnosis, what's most likely diagnosis, what's differential diagnosis, and they discuss this in 3 minutes. And after these 3 minutes, then there will be bell 2, which will see move to, then you have to go to next station, and then you have 1 minute from going this station to this station. So in this minute you do not read the instructions. When the 1 minute passes, then they tell you no, you can read instructions. So each station has consists of 9 minutes. There is usually 1 or 2 examiners, and each station has equal marks. There are usually 20 marks in each station, and these are how the OSCE circuit is arranged. Like these are 14 stations. We know in exam there are 17 stations, so this depends on availability and where you take exam. Your station may be in one place or maybe in different part of a building. So suppose you can start from any of these areas, and when you start suppose here, then you move in this direction, and then you go through all the station, and then you end here. So you go one station, and this is how OSCE circuit is arranged. So this is little bit more detailed. Suppose you start from here and you have first anatomy station, you finish this station, then you go to clinical examination, you go to next station, and you can start from your first station can belong to actually any station. So it's not necessary that you will start with anatomy or pathology station. You may start with rest station. So we have discussed rest station. You just rest, and then there is preparation station. There are two preparation stations, and these are preceded by information giving stations. So in these preparation stations, you have notes of a patient. Like the task is outside, say you will read notes of this patient, and then you read the notes. The notes will tell about history of patient, physical examination, labs, progress, what happened to him, and what is recent diagnosis, and then you assess from it that what is the, you get all this information and you go to next station and you discuss this information with colleague. You give him information that this is patient and he came with these symptoms, then we diagnosed this, we did this labs, and this is the these are the two stations. This is actually one station. In one station you do preparation and you go to next station and you discuss with colleague, and this is actually one station but consists of one preparation station and then one discussion station. Then you go to, then you keep going this way, like you can see surgical pathology, history taking, critical care, then you can get rest station, then you can get preparation station, and in this preparation station you have patient notes as well, and at the end of patient you will have to give information to a patient or his relative and tell them about like about their diagnosis, or uh, this assess your communication. So these both stations which are preceded by preparation station assess communication skills. These are communication skills stations. So you go through all 17 stations and before the end of your exam. So this is how these stations go. So we have discussed how these stations are structured. Now we'll discuss individual group of stations. We'll briefly discuss it now, and then later on we'll discuss in detail all these subjects. So anatomy stations, we know there are 3 anatomy stations, and this is applied anatomy, and in each station there is 1 or 2 examiners, and there can be an actor or a person on whom you may demonstrate some surface marking or other anatomy related questions. So what you see in anatomy station, how are these assessed? These stations are assessed based on dissection images. They can display an image. Suppose this is an image of biceps muscle, and they say what is the name of this structure, what is the name of this structure. This will be one question. What is its nerve supply, and then what are its 2 actions. So, and then they ask the second image, maybe that the nearby image like brachioradialis muscle, or maybe any structure in the cubital fossa like median nerve or brachial artery. So these are the questions are based on dissection images, can be radiology images like X-ray or CT scan, but usually there are questions, but they usually deal with normal anatomy. And then question can be asked from bone or skeleton, can be asked from surface marking. So there are 3 stations. You can get you can get question from head and neck, from skull, from thorax, from abdomen, from limbs, and we'll discuss these topics. And in pathology stations, there is can be interpretation of data, like interpretation of laboratory results, interpretation of an pathology image, can be a image demonstrating a lesion, and then questions are asked, and then they can be interpretation of laboratory results, and then questions related to it, what can be cause. And in critical care stations also, they are like pathology station. These are knowledge station. They assess interpretation of data and interpretation of images, and then make your differential and discuss about management. In clinical examination stations, there are 3 clinical examination stations, and this examination can be orthopedic examination, can be examination of shoulder, examination of hand and wrist, examination of knee, can be abdomen examination, chest examination. And in these stations in UK, there are no real patients these days, and they're only simulated patients, and they are sometimes they may have pathology, but they are not real patients. So performing a clinical examination, you have to do this task in 6 minutes. You have to complete this examination in 6 minutes, and after 6 minutes you will be asked to present your findings, and then they will ask you further questions like what you think, what is pathology, and we'll discuss this in clinical examination stations. But they ask what is most likely diagnosis, what's your differential, how you will further investigate it, and how you will treat it. And in these stations, you also have to demonstrate professionalism and make sure that your patient is comfortable, and you do swift examination without eliciting any pain to patient. So procedural skill stations, these are 2 stations. In one station, you perform a procedure like you may need to do a chest tube, or you may need to do a suturing of skin lesions. They're not very complicated procedures like doing an operation, but these are the procedures that are assessed. And in second station, you are assessed a surgical skill. Surgical skill means like hand knot tying or instrument knot tying, and you perform these skill in second station. So in one station there will be simulated patient, in other station there may not be any patient. So in history taking, again we have is divided into 6 minutes and 3 minutes, and you take history in 6 minutes. You take all the components of history: presenting complaint, history of present illness, past medical history, medication history, allergies, and we'll discuss it the format later on. And after 6 minutes, then again they ask you question and present your finding, and then ask you questions like that are asked usually in history taking. What's your differential diagnosis and how you will proceed. An information giving station we have briefly discussed. One station involves giving information to patient or relative. These are standard communication skill stations that are assessed in exams, like breaking bad news, like giving a diagnosis. We'll discuss when we reach to this section, because this needs to be a systematic approach to doing these stations. And in second station is a giving information giving station to colleague, and it's usually telephone discussion, and you discuss a patient to your senior colleague like consultant, or to other senior colleague in hospital or other hospital. So in this again you need to, because this is communication with colleagues, so you have to have good knowledge as well. And in communication skills, knowledge is also assessed, because your communication is assessed, but your knowledge needs to be also accurate. You cannot give wrong information to patient, and if even your communication is right. So this is the brief introduction to this exam. You need to remember that you need to pass in two broad content areas, and these broad content areas are assessed by different group of stations. Then you know which group of station is in each broad content area, how is a station structured, and then what you expect in how these stations are assessed, like anatomy station, pathology station, or physical examination. And later on we'll discuss all these stations in detail, and also we can discuss any questions.